what I'm trying to do next 10, 15 minutes, basically to communicate to you, emphasize you, how serious our research was, uh, what sort of technology we used it. And I'm assuming that a lot of people are not very familiar with the quantitative research. Those who are from quantitative background may find this is not very, very, very special. But in addition to that, I would like to take you all through some of the findings very briefly, just to give you a sense about some rough idea about our data. Because this afternoon we will be having a serious paper written by an economist, right, Professor Dhireni Gunawardena. So I'm not going to dwell on those analyses, just to show you the gendered nature of unpaid care work with some numbers, and also to trigger a discussion. So I just want to have a discussion among the audience about these findings, right? So methodology, as I said, this is we are using quanti as well as a qualitative research, because knowing very well, because we wanted to really sail into new terrain, new area. So we want not only to collect data, because while collecting data, we also understand the importance of a lot of explanation. So as a result, we did quanti as well as a qualitative research. And we got the massive assistance from our partner organization, because this kind of a research cannot be done without the help of our partners who were in the various districts. So they were kind enough to provide this assistance, finding our respondents and spending days and days with them, training and providing assistance to the respondent to fill the questionnaires. In this quantitative research, we wanted to get a sense about the average overall picture about women unpaid care work. So in order to understand, so we need to have some sort of comparative perspectives. So therefore, we surveyed 5 districts, 6 locations, and we surveyed men as well as women, because you can't talk about women unless you really have something to juxtapose with. So we did a small sample of men as well. And also we employ, don't worry about this graph, this is just to say that how much effort we have put in order to make sure our survey is very, it's trying to capture various aspects, ethnic categories, age categories, the income categories. So we basically developed a quota sample, giving a very extensive quota. So altogether we did 840 interviews. Out of that, 700 interviews were done with women, right? And we went in 3 waves. The first, we had a general survey where we went and asked about average household information and the information about the respondent and the kind of a work or economic activities he or she was involved with that. And with that, we got their permission to administer a diary. So with the permission, we basically visited them again with a diary. So diary is it's a pretty complex document where we have trained our respondent to fill the diary, every single respondent's filling 7 days on selected week, 7 days. So every day that person will have to say that how much time that you spend on each activities, right? But we have given them 26 different activities that falls into the general international categories. So this particular selected respondent has to fill this 7 days, because we want to get an average case of any given day. But in addition to that, we were also concerned about the seasonality, because sometimes when you are doing the research in a agrarian area or maybe certain villages where you can have a seasonal effects, right? So in order to avoid that, we repeat the diary study within a month interval, right? So in order to get this, like in order to address this seasonality aspect, so what we used for our data analysis is the average cases, like any average given day, how much time that a random person spending on each activities, right? So that is what we use. It's not that easy, like to visit the household so many times and get a person to remember and really feel it. So you need a lot of training and assistance. So I'm very grateful for our partners who really help us to do that. Now, just to show you like a few data points, right? Uh, of course, this survey has a huge amount of like the massive data set. I'm just showing like 3 tables actually. We basically ask them whether they like to engage in paid employment, right? We ask this from men as well as women. So what you see is like, men and women both are equally interested in engage in paid employment, right? In fact, actually, like more women than men, right? And then we ask them reason for unemployment, right? Like if you are agreeable, or if you are willing to engage in paid work, and if you are not employed, why you are not employed? So now what you see here is like 96% of the men. So 90% of men says that like they couldn't find a job. Those who are willing to engage in employment and are not employed at the moment. And 49% says of women says the same thing, where they couldn't find a job. But what is interesting is what I really like to highlight in red color, where the women, out of the women that we interviewed in this study, out of the women who are willing to engage in employment, paid employment, who are not employed because there's no one to take care of their children. I mean, this also like very much resonate with what we've been hearing from this morning, right? The care obligation, right? And when you look at the reason for not wanting to engage in paid employment, I mean, the numbers are extremely small. This is the results picture that we got from women respondent. The reason why I'm saying, because we have a lot of myths about the women not want to engage in work. So out of the women who says that who don't want to engage in work, 29% say that I don't like to do a job, right? And 14% or 15% say that it is inappropriate to do a job. Just to highlight the fact that it is a very tiny percentage that women are out of job because of the social stigma, right? I mean, there are a lot of women want to get in jobs. They are not in employment because of their the care work responsibilities, or if not, they are, our economy was such they cannot be like absorbed into the economic activities. Now, this is the last set of tables that I want to show you. We using our diary, we have given them various activities, tasks. We want to find out how much time they're spending. So we got them to calculate in minutes, not in hours, right? So these are in minutes. A woman or man engage in these activities per day. So what you see right now, I mean, this is like SNA activities, the salaried job, and salaried jobs from home, and then home gardening, agriculture activities. The fourth one is taking care of elders for payment. So here clearly, like you see that more men are engaged in the paid jobs outside of home, and then you see that the salaried job from home, almost similar percentage, right? Clearly, if you look at the total number of minutes, time that the men and women are spending on SNA activities, clearly the men are engaged in more SNA activities than women. But non-SNA activities, right? Uh, Here what you see, uh, if you look at the taking care of children, right? There's women spending 67 minutes per day taking care of children, whereas the men only 38, right? So there are you see there are activities where the taking care of children you own, and then you have the taking care of children of your family members, right? In both cases, women are engaging doing these activities, right? And the last set of activities were the personal activities. Now, things like reading, where women seems to be spending little more time than men in terms of reading and entertainment, right? But when you look at the things like the visiting relatives, right, and entertaining guests, you see that the women are spending more time. But interestingly, you must ask yourself question, these activities are activities that women are doing for themselves, or they are doing it for the family? I mean, there are some certain leisure activities that we have basically we have encouraged women to engage, but they are not doing it for fun. They are doing it for for the benefit of the household, for the benefit of their family. So what you see in this table is that, Professor Diniti will take us to a much more serious analysis. What I want to say here is, if you look at the total, even for this 26 activities, if you look at the total amount of time spent by average woman, that time exceeds the 24 hours. That time exceeds the 24 hours, which is to say that an average woman are engaged in more than one activity at a given time. So which is sometimes we may not have recognized, they are engaged in more activities. At the same time, while they're cooking, they may be looking after their kids, or maybe their elderly parents, so they do that. And also, even though I don't have data here, this survey shows us this unpaid care work, the contribution, the commitment also varies across different class groups. Now, for example, those who belong to low income brackets seems to be having little relief compared to those who belong to higher income bracket. And perhaps that's where the sociology comes in, where when you live in a kind of a communities where you have more help available in your community, so you situation where the women get more less burden. But whereas when it comes middle class families, you see the unpaid care work burden seems to be high. This is something that roughly suggesting this data. I will not really try to conclude this. So these are some of the findings that we found this research. So I would like to stop here. Thank you.